leads nicely into what I'm going to be talking about, and that's empowering our young adults and teenagers as they move into the adult care. It may not be, I guess, relevant to some of the people on the call at the minute, but it's nonetheless something to, if you have family members or if you are in a family with cardiomyopathy that's inherited, to have in mind. Okay. So basically, as parents, we're there from the very beginning, and sometimes the journey into a diagnosis of cardiomyopathy is quite a scary one with children. It can often be an undiagnosed, something that's happened in an emergency situation. It can sometimes be misdiagnosed, and there's several hospital trips back and forth, and this might be familiar to everybody that's on the call. And for parents, when you have a child with cardiomyopathy, you're there from the beginning. You're in control of that child. You're caring for that child. You're doing everything for them. You're taking them to hospital. You're taking them to appointments. You're emotionally invested. You're giving them their medication. So it's very much, the parent is in control. But when it comes to transitioning into from young adulthood into the adult service, it's about empowering the young person and with the support of the parents. And this is a very, gradual, scary process for a lot of parents. But, this self-management is a skill it's needed for people with long-term conditions like cardiomyopathy. And it needs to start in childhood, and the discussions need to be starting earlier. And it is a lifelong skill that needs to be learned. And parents do find this process very difficult. So what is transition? Nice guidelines, which we've heard lots of Jane talking about this quite a lot. And every guideline that is put in place is recommended to be used by NHS services. And the transition is no different. And that came out in 2016, the guidelines. And that's a nice little, I've just simplified it by putting their little transition process graph up. And that just explains the different processes that need to be put into place when you're in a cardiology service, in a paediatric service. And that's not just in cardiomyopathies, it's all long-term conditions that children may have to confront with. So transition is a gradual process. It's something that is, it's a slow process, and it's not something that just happens overnight. It takes lots of planning. It's planning with the child or the young adult, not the parent so much. They're in the background and they're there to sort of advise and be around. And it is basically what it says on the tin, moving from children's services into adult services. Why do we need to have a transition program in place? Well, again, everything has to come down to evidence, and there has been lots of evidence, lots of papers that have come out that having a transition program in place absolutely has long-term better outcomes. We know that children that have transitioned through a dedicated program stay in the system, and they are not missed, and they're empowered to knowing about their condition, and they move into that adult service with confidence and take control of their condition. It helps them take the ownership and makes them fully aware of what their cardiomyopathy is before they move into the adult service. And it's usually based around a holistic program, looking at everything from, your cardiomyopathy, the medical side of things, but also the psychosocial, vocational needs of that young person. So moving in from education, perhaps into the work sector. And as you get older, moving from being a child to a young adult, it's you change, things are changing, and you might not want to discuss certain things around your parents anymore when you're going to your appointments. So this is all put in mind as the child's moving through to the adult service, transitioning through their program. And we know that adult services are much better at dealing with, issues such as work, travel, insurance, education, all those kind of things that adults have to face as we grow up. And most children in terms of teenagers, they do, as they're getting older, they prefer to be seen in a more grown-up environment. They find it, most children you speak to or teenagers that you speak to do find going to that, back to that paediatric clinic with all the screaming toddlers and children a little bit more annoying. So when's a good time to start transitioning into, start talking about transition to your young adult or teenager? There's no exact date or day or time that this needs to happen. Within the NICE guidelines, they just talk about, transitioning around the ages of 13 years old. But, that's in joint discussion with the parents and the family. Your teenager or young adult might not be ready to even begin talking about that for some years yet, and will be guided by the family's decision on that. And I think the main take-home message is that it shouldn't feel rushed, but we usually start, really starting to push it around the 16 to 18 years. And usually by that age, the teenager is ready. So choosing that adult service, now that usually is where most of the discussions can revolve around. A lot of the time, people will have a specific clinician that they may have in mind that they want to move up to. They may have, done some research. A lot of the time, the teenager, family, young adult may not have any idea, and they're going to be guided by their pediatric cardiologist. So, and a lot of the time, the pediatric service has a very close relationship with, particular adult services. So that transition is very easy. But I think, at the end of the day, it has to come down to that young person and whatever suits that young person. So, if they're moving off to university, or perhaps they're going abroad for a gap year, it needs to sort of fit in with that kind of lifestyle. So again, the transition, this was piloted by Southampton University General Hospital. Some years ago, they got this great booklet together called the Ready, Steady, Go program, and it's used by a lot of hospitals. I know that ones that I've worked in previously have used this program, and it's a dedicated little booklet that's given to your teenager, young adult when they're starting to talk about transition, and then they bring that along to every appointment, and it's got lots of information in there, and we start documenting the process for that teenager, young adult. So who's going to help you do this through this transition? And it's fairly obvious. We've spoken about, it's your pediatric cardiology team, your nurse specialists. You may have other pediatricians that your child or teenager is involved with. Perhaps they're under other specialists in terms of gastro specialists or endocrinologists, geneticists, all might be involved. So it's a joint decision. It's a joint holistic way of transitioning that teenager into the adult service. And I think one of the main take-home messages from transitioning into the adult service is being prepared and getting ready. Okay. And these are the things that we know are helpful in getting ready. So, like we've touched on and Jane has spoken to eloquently about, is knowing about our cardiomyopathy. So does your young adult teenager know what their cardiomyopathy is? Can they explain their ventricles from their atriums? Do they understand a lot of the medical jargon? Do they understand what exactly is going on with their heart and why they need to be going to appointments and why it's so important that they look after their own cardiac health? It's also very important for them to know who their team is and who their team is going to be. So just getting to them to be aware of those teams. Treatment options, plans of care. This is for everybody. It's good to have insight into what it is that's being, your options of your treatment. So are you on a medication regime? Do you have a device in? Is there talk about having a device in the future? Is there discussions that you'd like to be having about future plan? That kind of thing. And also care plans. Most children going through school will have a care plan that they've taken to school. Does that need to be transferred as you're transitioning into a different setting, i.e. university or, going on a gap year or a new job? It's getting that young adult teenager understanding their condition and knowing about their care. And you'll have nurse specialists within your organisation that help you do all of this. So they will be the ones that will help you with the care plans, and they'll write all of this down for the young adult. Other things to be discussed at appointments as you're going through the transition program is understanding how beneficial it is as you become more independent, away from your family, is understanding the importance of a healthy lifestyle, things around, risk-taking behavior for teenagers, such as drinking, exercise, smoking, drugs, sex, all those things that might be uncomfortable to talk about with your young adult and teenager. It's good to have those discussions with them, even if they are uncomfortable. We know what teenagers can be like. And it's just making sure that that young adult or teenager is able to make good, informed decisions as they move away to be more independent. Support networks, this is crucial, and Jane talked about this as well. And it's really important that your teenager, young adult, knows what support networks they have in place as they move away and become more independent. As Jane's touched on as well, we have lots of support within the organisation, within Cardiomyopathy UK. Like I've said, I'm the paediatric nurse, but I also run an out of hours young adult, young teenager helpline on a Wednesday evening. And we have lots of other support groups that we're putting in place for this young cohort, and I'm piloting now the youth project within the charity. So it's completely overhauling our youth services that we offer through the charity. And one of the big draws that we're trying to get started up is our youth panel. We already have a youth panel, and all charities around the world will have youth panels that if they offer a youth service, will have a youth panel on board. They're there to help shape the charity in the way that help us to make sure that we are giving that young community a voice, so they know that we're there for them, and then they know the services that we provide are specific for the young people and that they're relevant. So they're there to advise and educate us on what it is that they would like to see from the charity and what support that we can offer. So, and the youth panel's there to help raise awareness for cardiomyopathy and for other young people that may have cardiomyopathy. So we're trying to recruit young people presently to join our youth panel, because our current youth panel that we have just getting a little bit old. They're at the ripe old age of 25, believe it or not, and they're classed as too old. So if you do know any other young people that would be interested in joining our youth panel, helping to shape the youth services that we have at the charity, we'd love them to get in contact with us. So do just drop me an email or through our support nurse channels. And that's pretty much it for me here. Thank you very much for your time, and any questions that you might have, pop it in the chat.